everybody. It's good to have you join me. I'm Dr. Kevin Usry. This is all about health and wellness, and we are sponsored by All American Wellness. We are also being able to bring our message across to you through the efforts of podcast junkies in Boca Raton. I would suggest all of you who want to get your message across to the masses, get in touch with Ben Castro, producer extraordinaire, and his partner, Christian Perello. These fine young gentlemen really know their profession well, and they will help you in any efforts that you have to get your message across to the masses. I suggest you look them up on the internet or give them a call. They're in Boca Raton. Today, we're going to be talking about a specialty I practice within the chiropractic field called applied kinesiology. But let me set the stage a little bit so that you understand what chiropractic is all about. You want to become a chiropractor as a young person? Well, the first thing you're going to have to do is go to college. And you're going to take a science-based approach towards getting your bachelor's degree. So if you wanted to be a medical doctor, if you wanted to be a dentist, if you wanted to be an osteopath, or even a veterinarian, you would have to get your bachelor's degree in science. And that requires that you have a certain amount of hours in chemistry, biology, physics, all of the sciences that will culminate in giving you a bachelor's degree in science. At that point in time, depending on where your interest lies, you're going to decide as a young person whether you want to become a medical doctor or an osteopath and treat disease and pathology, or whether you want to be a dentist and specialize in treating oral issues, or whether you want to be a veterinarian and you want to take care of people's animals. This will all depend on what particular school or college that you want to attend. When you want to become a chiropractor, you go to chiropractic college. It's a 5,280-hour course. It takes 5 years typically, though they do have an accelerated program. If you want to do the 5-year program in 3 and a third years, you can do that. You just don't go on the typical 2 semesters a year program. You'll do 3 trimesters. And at the end of those 5,280 hours, having sat for national board examinations in basic and advanced sciences, as all students have to, no matter what profession they're going into, whether it's chiropractic or medicine or osteopathy or dentistry. There are basic areas of scrutinization for your education to make sure that you're meeting the standards that are required by the Department of Health and Education in the United States. Once you've graduated from school, you are licensed to practice as a chiropractor. And as a chiropractor, you're specializing in functional health, and your focus and center has to do with the nervous system, specifically the protector of the nervous system, the spine. And many chiropractors go into specialties. Some become chiropractic orthopedics, like I did. Some go into internal medicine, like many of my colleagues. Some learn about sports injuries and sports chiropractic. There are a number of different specialties that one can decide to focus. There are approximately 3 years of postgraduate education. And some decide to move into nutrition. That could be anywhere from a year to 3 years of postgraduate education. And when those specialty examinations are passed, that doctor can now focus their practice on their particular area of specialty. For me, it was applied kinesiology. I took the basic course when I first got out of school, which was a year-long course that gave me extra tools to use in addition to the tools that I was taught and the approach that I was taught as a physician. Chiropractors are recognized as primary care physicians in the state of Florida. So we are what they call the portal of entry physicians. If you have some kind of problem, you can go to a chiropractor, an osteopath, or a medical doctor, and we are all trained to recognize disease and pathology or functional issues. Chiropractic specializes in functional issues, and this is the realm in health that we practice and focus. When you're an applied kinesiologist, you can continue your postgraduate education anywhere from 3 to 5 years. I had completed approximately 5 years when I sat for my diplomate boards. It's a series of 5 written examinations that you have to pass and a practical examination given to me by, at the time, 2 medical doctors. One was a neurosurgeon, one was a neurologist. Principally, applied kinesiology in the United States is practiced by chiropractors, but throughout the world, applied kinesiology is practiced by medical doctors, osteopathic doctors, dental physicians, even some veterinarians use applied kinesiology. These are extra tools for diagnostic and treatment purposes that physicians are taught. It gives us, if you will, another tool to pull out of the toolbox that enables you to have better insight to, in this case, how the person's nervous system is functioning. It could be biochemical function, it could be biomechanical function, it could be bioenergetic function. With these tools of applied kinesiology, we're able to determine where certain areas of dysfunction may be occurring. There is a lot of prejudice out there in regards to chiropractic, as there are in so many areas of life. People hear things, there are rumors going around, there are prejudices that are taught and handed down from one person to another. It may have been what a medical doctor heard when he was in medical school by one of his professors. Frankly, could be something that was taught to the chiropractic student by one of their professors. Prejudice has no bounds. Prejudice is steeped in misunderstanding and lack of proper scientific thought. And this is unfortunately some of the issues that we've had to deal with as applied kinesiologists. But it is recognized throughout the world as a credible approach to diagnostics and treatment. And as I said, it's practiced by many different people in the healthcare profession. Could be medical doctors, could be osteopaths, could be dentists, could be chiropractors. And this is the area of focus that I've chosen and chose as a young man. As a matter of fact, when I was a student, I was learning about applied kinesiology. Of course, before I was able to practice my approach, I had to get my doctorate as a chiropractor, and then I could begin using the applied kinesiology after I passed my examination that gave me the ability to use the basic education that I had obtained in that year. And of course, I have continued to improve my education over the years, and I have been mentored by men of great mind and great scientific ability. And the physician I am these days, I consider to be a master physician at what I do, and it has to do with all of the men who were professors of mine who took the time to teach me and cram that information into my brain. And I'm thankful to all of my mentors that took me under their wing and taught me how to become a better physician. Each and every one of them, I thank you. Now let's talk about some of the things that we do as applied kinesiologists. Let's back up just a minute. Let's say you go to the average chiropractor. So you're going to walk into the chiropractic office, and let me tell you, it doesn't hurt. So no matter what you've heard, doctors are highly trained to deliver their adjustive procedures so they're gentle, safe, and effective. And one of the reasons I can tell you that, insurance companies have no bones to, pardon the expression, they, they, um, they don't care who they're insuring. All they're interested in is, are you creating a lot of problems within your profession? Are you harming people? Is it happening frequently? And Based on this, this is why chiropractors pay such a little amount for malpractice insurance. There's very rarely any instances where people are harmed. There is very rarely instances where malpractice occurs. This is why we pay such a low amount in malpractice. And should something untold happen in a chiropractic office, the problems are minor. And again, I look back to the amount of money that I pay for malpractice insurance. It's about $3,000 a year. The average medical doctor pays anywhere from $15,000 to $25,000 a year. When they make mistakes, the mistakes are that much more complicated and impactful on a person's life. But this is strictly how things are in the profession of healthcare. If you have a lot of issues where there's a lot of malpractice and your malpractice issues create a lot of harm to people, then you pay more money for your malpractice. Anyway, so let's go back to what happens when you're in the chiropractic office. You're going to fill out some applications for treatment, some basic information. Once you've done that and the paperwork has been completed, you go back and speak with the doctor. The doctor is going to sit down with you. He's going to ask you pointed questions and thorough questions on what your issues are of concern in regards to your health. After taking a thorough history and performing a thorough orthopedic, neurologic, and chiropractic examination, there may also be some digital x-rays taken so that the doctor can see the spine and see if there are any types of diseases or issues that can be appreciated on diagnostic imaging, because to see is to know and to not see is to guess. So there's no guesswork involved when you go see the chiropractor. They're going to do thorough due diligence to make sure they can determine how you're functioning. At that point, you will sit down with the chiropractor. He will go over what he found in his examination. He'll go over uh, the aspects of your diagnostic imaging. He's going to make some recommendation, or she is going to make some recommendations on what you need to return your health back to normal function. At that point, you'll put yourself on the table, and the doctor will start palpating or touching your spine and just seeing how those individual 33 bones are moving. In the spine, the specific name for a bone in the spine, it's called a vertebrae. And they should rotate like you rotate. They should bend to the side like you bend to the side. They should bend forward and backwards, just like you bend forward and backwards. When they don't do that, when those bones don't move either in all of those positions or having problems moving in some of those positions, it's known as a vertebral subluxation. It's a big word, but vertebral subluxation being treated in a chiropractic office is as common as cavities being treated in a dental office. It's a very, very common problem people develop through stress and strain, through improper physical habits, through improper sleeping habits, due to slips and falls and car accidents. All of these are common issues that can affect the spine. The doctor will find those subluxations, reduce those subluxations in a painless, quick, rapid manner. They may perhaps offer something that we call physiotherapy, things like heat or ice, electromuscle stimulation to reduce muscle spasms, ultrasound, laser, decompression. There are a whole host of additional tools that the chiropractor can use to bring you back to normal function and to help you feel as comfortable as possible, certainly feeling a whole lot better leaving the office than you did coming in. How would it be different if you went to an applied kinesiologist? Well, there would be some additional things that would be done, but the basic things that I just described to you about going into the chiropractic office would be all the same. There would be a thorough history, a thorough examination. That would be physical examination, orthopedic examination, neurological examination, and of course, chiropractic examination focusing on the spine. There would be diagnostic imaging performed. with the addition of muscle testing. Now, I'll tell you the same thing I tell all the patients. These are tests, they're not contests. We look to see how a specific muscle is functioning. There are many different muscles we can choose from, but all of these muscles have one thing in common. They have to get their stimulation and function by virtue of the brain sending messages throughout the brainstem, into the spinal cord, and to that particular segment or level in the spine that has a nerve attached to that particular muscle, and we test it to see if it's functioning. Can you provide resistance when the doctor is putting pressure on that muscle? And again, emphasize once again, it's not a contest, it's a test. When I explain to patients, I just want them to do the basic function that I'm asking them to perform. Can you provide resistance when I give it to you? Yes. In this case, we get some basic information on how the nervous system is functioning. You can listen to my instructions. You have enough cognitive abilities to understand what I'm asking you to do. That stimulation is being created from a part of your brain called the thalamus, down through the brain stem, into the spinal cord, to that specific area of the spine and nervous system that functions that particular muscle. And yes, you're able to complete that and give me resistance. That's one of the possible outcomes when we do a muscle test. Another would be when we test that muscle, it just doesn't lock, it can't provide adequate resistance. And this starts to speak about how our nervous system functions. Whether you know it or not, a computer functions on some basic levels. Something is either X or something is O. It's either turned on or turned off. And that's how our nervous system functions. So when it's turned on, we have what we call facilitation, or quote unquote, a strong muscle. I don't like to use that term very much in the office because patients right away start on the wrong foot and the wrong way of thinking. I either look for a muscle that can do what I ask it to do, the nervous system is facilitating that function, or it's inhibited. The nervous system is not facilitating that function, so you have an inhibited muscle. When you go to provide resistance, there is not enough resistance to meet that determination that that muscle is functioning well. Again, this gives us great insight to how your nervous system is functioning on a bioenergetic standpoint, on a biochemical standpoint, on a biomechanical standpoint. So, with this additional tool, as kinesiologists, we're able to gain a lot of insight to different areas of the body above and beyond biomechanics. And this is why in our office, we tell people we treat conditions that you would normally go to your family practitioner for. All sorts of different issues, headaches, emotional issues, difficulty sleeping, energetic issues where you just don't have the energy that you should have, difficulties with digestion, difficulties with elimination, difficulties with being able to move in certain positions because pain creates issues for you. So these are things that we see as applied kinesiologists in our office. We are in this country mostly chiropractors practicing this specialty, but it is no different than really the basic function that a chiropractic physician performs, with the addition of the muscle testing and some of the insight that helps us address issues of nutrition and biochemistry. Some of us doctors have additional training in acupuncture. For instance, I took the boards this year in acupuncture, and we practice what we call bioenergetics in our office in addition to the other areas that we focus on. We use acupuncture needles to stimulate certain areas of the body so that the energetic flow of energy is not interrupted or blocked and the person is able to maintain normal function. Let me see if I can address some questions that my producer extraordinaire, Ben Castro, had put before me while we were getting ready for the show, and I said, "Yeah, let's go ahead and answer some of those questions, because obviously we don't have live call in here, so we're going to depend on Ben Castro giving us questions that maybe you out there are curious about or and want to know more in that regard." So, Ben Castro, please fire away. Give me the questions that I need to answer.
How are you, Dr. Usry? It's great to be here with you. Um, I've always had this interest for applied kinesiology because it is something that is newer to me. So, are there any potential risks or side effects associated with applied kinesiology? And I guess how do you address any concerns regarding regarding those?
Well, I think I did address that, but let's roll back a little bit. Applied kinesiology is a specialty within chiropractic in this country. As I say, other health practitioners utilize it throughout the world. Could be medical doctors, could be osteopaths, could be dentists, because they want to use more tools to give them better insight in diagnostics and treatment. As far as side effects, there are no risks that are above and beyond the risks that you would take by seeing a chiropractor. Everything is risky as soon as you get out of bed. There's all sorts of risks as soon as your feet hit the floor that you could trip and fall and hurt yourself. So the inherent risks about seeing a chiropractor, we talked in regards to how much malpractice costs for a chiropractor. Very little, because the issues of malpractice, and when malpractice unfortunately occurs, the harm that is created to the patient is minimal. So this is why we pay such a small amount in malpractice insurance.
Gotcha.
Applied kinesiology simply allows us to utilize the tool of muscle testing to get greater insight to our diagnostics. And frankly, when you're a physician, the accuracy of your diagnosis is going to have 100% to do with how effective you are going to be in your treatment. Have you diagnosed this condition properly? If you have, then you're adhering to the standard of care and you're applying the proper procedures to help that person with that particular diagnostic issue.
Very nice, awesome. That does make a lot of sense. Now, I'm sure you have some clients that are a little skeptical about applied kinesiology, or they have criticism towards it. How do you advocate for its benefits, other than
Well, applied kinesiology was started by Dr. George Goodhart Jr. in the 60s. Dr. Goodhart was, frankly, a genius. He was an extremely intelligent man. He was a second generation chiropractor, and he approached chiropractic utilizing scientific evidence of many forms of health care that he had read during his times where he was performing research. He really came up with different premises and started using tools that were used early on in health history, such as Kendall, and Wadsworth, which were uh, physical therapists who initially started muscle testing, using specific muscles to determine how they were functioning, to give insight to how a person's biochemistry, biomechanics were functioning and at what level they were functioning. Dr. Goodhart continued to do more and more research. He took a lot of work from the osteopathic community, and there were many, many different osteopathic physicians who had done a lot of pioneering work on functional treatments and functional diagnostics to determine what is wrong with this particular patient. And when you can't find out what's wrong with a patient, a good physician won't throw their hands up and say, I give up. No, they'll constantly use their scientific training and education to delve deeper and deeper into the physiology of the body to figure out what is causing that patient's problem. Why can't they find help with other practitioners? That's really what makes a good physician. It's not your successes. Your successes only serve to inflate your ego. Your failures, or your temporary failures, or your areas where you're having difficulty and really have to put your education to the test. This is how you grow as a physician. This is how you learn to be part physician and part detective, to figure out, why is that? Or why isn't that? Why isn't that responding? What could be going on? And through those types of questions, and through that type of unrelenting curiosity and desire to help someone, is how a physician grows and becomes a better physician, and how a patient is served by the doctor of that community.
That makes a lot of sense as well. So Dr. Usry, I think that's actually you answered a lot of my questions before I even asked them. So those were the two that I had for you. The
Good.
other ones were answered. So thank you
Perfect.
so much.
Oh, you're
So
welcome.
I appreciate
We
that.
still have some time there, so let me just go over some of the things we treat in our office. I'll start at the head and work my way down. If you're having headaches, there are 8 common headache syndromes that people suffer with, in addition to migraines. And we address those issues using applied kinesiology to get to the bottom of why that person is suffering with head pain. We also work with patients in regards to emotional disturbances. Most emotional issues that are affecting a patient are functional in nature. A smaller percentage of those patients suffer with mental health disease, but a larger percentage actually are suffering from abnormal biochemical physiology. And those people can benefit greatly when the biochemical dysfunction is found, addressed, and treated. It can be a life changer. And you don't necessarily have to go on pharmaceutical medication, which inherently can create side effects that can be more serious than the condition they're treating. Many of you who are watching television, you see a number of the drug companies explaining to you indirectly that sometimes their medicine doesn't work. And when it doesn't work, you have to add a second medicine. And when you have to add a second medicine, you've now doubled the chances of untold side effects. And some of these side effects can be very, very serious: suicidal thoughts and death. And that is way too high a price to pay to have mental stability and serenity. Look to your physiology first. Look to see if biochemically there are problems being created by perhaps foods that you eat, perhaps problems in your gut that have an intimate effect on your brain function. So perhaps allergies and sensitivities, perhaps dysbiosis, perhaps just simple biochemical areas that are being unaddressed. Holes in our nutrition can create a lot of biochemical dysfunction. This can lead to the headache issues as well as mental health issues. Of course, like in all chiropractic, we treat neck pain and arm pain. We treat low back pain and leg pain. We treat mid back pain and, and sternal pain. All of these things can be helped by chiropractic. What we do in our office, we function as primary care physicians as chiropractors. And we also do applied kinesiology. We address your issues with digestive problems, with energy. Simple things like checking your B12 levels, your iron levels, and something known as your Krebs cycle to see if those are issues that are creating energy problems and fatigue. Some of it gets so bad, people come in and they have anemia and they don't even know it, and they're really simple things to address. And it's only a matter of doing some daily activities to turn that around, usually within 48 to 72 hours. A number of patients we see are not hitting that toilet every day like they should. And as a result, they're having a lot of issues with their health. One of them can be high cholesterol. So, how your liver and colon function together can have dramatic effects on your cholesterol levels, which happen to be a cardiovascular risk factor. And you don't have to necessarily address it with medication. And again, side effects from these medications many times can cause problems with how the muscles function, can cause problems with how the liver functions, can cause problems with how your brain functions. Always look to the simplest explanation to a problem. Occam's razor tells us that the simplest explanation is usually the correct one. And looking to see what is throwing that physiology off. If that person's cholesterol should be normal, if this person's function should be normal, what is creating that dysfunction? Getting to the bottom of it using applied kinesiology gives us that extra tool that really helps us use our detective skills to find out why that is. Why is that person having that particular situation occur to them, and why is it affecting their daily activities and their life? Let's get to the bottom of it. Let's treat it. Let's evaluate how it's responding to treatment. And let's feel blessed that we were able to find that particular problem with that patient and let them go on with their life functioning as they should. I think this is covering most of the things that we cover in All American Wellness. So give us a call for your free 15-minute examination. We're there for you. Just simply give us a call at 561 863 8779. That's 561 863 USRY. Usry. I'm Dr. Usry, and I thank you for joining me today. And see us once a week on Spotify, on Apple, and on YouTube. We'll look forward to seeing you next week. Again, this is All About Health and Wellness has been brought to you by All American Wellness and Podcast Junkies. Thank you for joining me. Be blessed. Bye-bye now.